Right side pain, vomiting, now a lung that gets traumatized without any trauma. Sounds odd. Probably is odd.
We should discuss this, then call her back.
Oh, it's fine. I made sure we got the South Pole long distance plan. Your latest kidney function test shows...
Well, I know what it shows. I ran it.
The more you interrupt, the longer my grandstanding is going to take.
Since when do you let patients participate in differentials?
Since the patient and her doctor happen to be the same person. Your kidney function is still declining, means you have a kidney problem.
But not one that needed antibiotics. Makes us equally wrong.
No, makes us both wrong, not equally. You were at least 6 wronger. They run a PPD before you shipped out?
On me and everybody else here, it's not TB.
Excuse us a second. Cancer explains her symptoms. A tumor in her lung or kidney that threw a clot to the other organ.
And you're worried the tumor might overhear and realize we're onto it.
Cancer's a hard diagnosis for patients, even when they're not in the South Pole. We should figure this out. Maybe bring Wilson in.
Obviously, you two think I'm in bad shape.
Only if you count the tumor.
House.
Probably in your abdomen. But you don't have any advanced imaging equipment. You also don't have a surgeon to biopsy it, any stains to use on the slide, or an oncologist to analyze it. Too far away to hold their hand.
I have cancer.
Possibly.
Since the only imaging equipment you have is X-ray, let's start there. X-ray your entire body.
I'm starting with the anterior cervical nodes.
Okay, turn your head. Locate the SCM muscle.
I know how to find my lymph nodes.
They teach you that before or after the class on fondling your inner child.
No swelling, no tenderness, and I can hear that, House.
Just thought I might help you relax. Anything in the axillary nodes?
All clear. Both sides.
Yeah, slide your hand to your sternum. Probe for nodes, moving slowly downward.
Down to what, House?
Sorry, can't hear you on account of your heavy breathing.
I'm supposed to be on oxygen, you tool.
Hold it. Fingers didn't go quite as deep. Feel that node again.
It's swollen.
Looks like you're doing a biopsy.
Based on this slide, you do not have cancer.
Oh, thank God.
I do see some inflammation, which could mean...
Okay.
You all right?
My left side, it hurts. It's the same pain that I had on the right.
Your other kidney.
No, I hope it's something. It's maybe. Oh no.
There is another test.
I think Foreman may have just broken up there. What he actually said was, there is no other test.
If you have an autoimmune disease, exposure to the cold should decrease your kidney pain.
If I go outside, we'll have our answer. And you knew about this.
I rejected it because if you're frozen solid, it's hard to get the needles into your arms.
How long do I need to stay out?
At least 5 minutes.
8 minutes outside would kill a healthy person. And healthy people don't suck on oxygen masks. Healthy people can pee.
I'll go get Sean, have him come with me.
Just take the prednisone.
Once I come inside. If it's autoimmune.
Are you all right?
Oh, I'm sure she's just fine. Kate?
We could talk the mechanic through the test.
Too complicated. Unless he's thirsty.
Drink her urine.
If it has a strong, concentrated taste, it means the problem's in her kidneys. Watery taste means it's her brain.
And then you can fix it?
Let's say yeah.
How do I get the urine out of her?
You'll take a straight catheter and insert
Those
it.
are your only questions? Not, is it safe? Or is there another way? Or are you out of your minds?
But you wouldn't ask me if...
Wait a second. You're in love with her. That explains why you're so eager to get her naked, then have a drink. Because most guys like to go the other way around.
Why do you care how I feel about her?
because now I know that I can get you to do anything to save her. Milk, lemonade.
It tastes kind of watery.
That's bad news.
Either increased intracranial pressure or something's wrong with her hypothalamus.
How do you figure out which one it is?
We don't do anything. You're gonna drill a hole in her skull. If she regains consciousness, it's increased intracranial pressure.
And if it's the other thing?
She'll die. But if it's the hypothalamus, she's dead anyway.
If the problem is the pressure in her brain and I fix it, is she gonna be all better?
Nope. But it'll give us more time to figure out what's wrong.
I have to get someone else. I can't do this.
You love her. Right? You'd do anything to save her.
Not this. I can't do this. If she dies because of something that I did, then
Listen. I am not going to let you hurt her, okay? Now, please. This is our only chance.
Okay.
That was easy. South Pole Doc is out of her coma. And now we have a new symptom. Increased intracranial pressure.
Why are we out here?
That's the patient room. ICP plus kidney problems plus lung collapse equals...
The most likely suspect is a tumor throwing off clots.
We ruled out cancer.
But not clots. What causes blood clots?
Bacterial endocarditis.
Not without a fever.
Deep vein thrombosis plus an existing PFO.
If I would have been discovered in her pre-South Pole physical exam.
What if the clots aren't clots? Atherosclerosis, fatty plaque builds up on the arterial walls, pieces break off, block blood flow. Explains everything.
She has 0 risk factors. Forget fat, think clots.
No.
You're standing up to me?
Maybe.
Just to clarify, you should do that when you're right. Sorry for the confusion. How could a
Could
clot...
be a different kind of fat emboli.
It's a perfect fit. Except it's completely impossible. Fat emboli requires an unrepaired bone breakage. Between the x-ray and the exam, I've seen her entire... Take off her socks.
I could do it.
No, I got it.
Your toe is broken.
Oh my God.
Bits of bone marrow have been leaking into your bloodstream. Those fat emboli have caused blockages in your kidney, lungs, and brain.
It doesn't even hurt.
Cold numbs everything. Does a particularly great job on the extremities.
You'll need to close the break to stop the marrow from leaking.
This one you will feel.
Will you do it?
He drilled a hole in your skull after drinking your pee. I think he's up for this.
Grab the tip of her toe with your right hand, hold the brake with the other. On the count of 3, pull hard. 1, 2, 3.
Splint your toe. You'll be fine.
Thank you, House.
Don't thank me. He's the one who saved your life.